Today, more than half the Maldives population is under 25 years of age. That's 51% of the entire Maldives population, and 22% is aged between 15 to 24 years. Adolescents from 10 to 19 years and youth from 15 to 24 years are critical periods of young people's development where an individual undergoes major physical and psychological changes and transit from the dependence of childhood to adulthood's independence. As the dominating young population reaches reproductive age, we need to find ways to utilize their potential and contributions, which is critical to the current and future well-being of the country and the world at large. Adolescence is a period of opportunity to prepare for a healthy, productive adulthood, as well as a period of risk where occurrence of health problems and initiation of risky behaviors could have adverse effects on an individual's future potential and well-being. Unfortunately, many of these young people face sexual and reproductive health challenges that can hold them back. In Maldives, the exact prevalence of adolescent pregnancies and unsafe abortions aren't clear. However, the 2011 research on reproductive health knowledge and behavior among young unmarried women in Maldives reveals that sexual intimacy and pregnancy outside of marriage is a reality in the Maldives. According to the 2004 Reproductive Health Survey, youth focus group participants expressed their view that Maldivian youth is generally sexually active before marriage, and 2/3 of those who have had sex said their first sexual intercourse before the age of 18 years. According to the 2007 study on women's health and life experiences, the majority of 18 to 21-year-olds, 92%, reported their first sexual experience as wanted or voluntary, as did 85% of 15 to 17-year-olds. The Biological and Behavioral Survey conducted in 2008 also provided alarming evidence of youth sexual risk behavior involving unprotected sex with multiple partners, among which are adolescents in the 15 to 17 age group and older youth. High-risk, unsafe, and unprotected sexual behaviors and practices undoubtedly contribute to the public health burden of the country. Issues stemming from the prevalence of sexual behavior among unmarried youth include a complex mix of health, social, economic, and legal consequences, primarily connected to the occurrence of unwanted pregnancies. Pregnancy during adolescence is a major health concern, as it is associated with death and disability among both mother and child. In addition, it could have adverse societal consequences, such as limitations in educational attainment. Statistics from the Family Protection Unit, or FPU, at IGMH alone shows that pregnancy outside of marriage was the third most common issue among patients who were attended to by the FPU, of which 68% consisted of young women between the ages of 15 to 24. The 2010 medico-legal records at IGMH also identified 41 cases of unmarried pregnancies, of which 32 were among adolescents and youth between the ages of 15 to 24. The Biological and Behavioral Survey of 2009 and qualitative research found evidence of high-risk behavior among youth, ranging from injecting drug use to group sex and even sex work, combined with very low condom use and an extremely low perceived risk of sexually transmitted infections. And yet, the vast majority of adolescents don't have access to reproductive health services, as institutionalized reproductive health services are available only to married couples. Nevertheless, there is ample evidence to show that this situation is inconsistent with the realities of youth sexual behavior.
Look, there is no single solution. Instead, what we need are interlinked actions. Provide comprehensive sexuality education which is age-appropriate and non-judgmental, is accurate and delivered by trained teachers, and is supported both in and out of schools. But life skills education and information will not work if there are no youth-friendly sexual and reproductive health services and counseling. And that must be private and confidential, affordable, accessible to all, and delivered by trained providers. Finally, laws and policies must enable young people to access these services while respecting and protecting their sexual and reproductive rights. To improve young people's sexual and reproductive lives, we need to support comprehensive sexuality education. We need to ensure that young people have full access to sexual and reproductive health services. We must amend or enact laws and policies that respect young people's sexual and reproductive rights. Let's create a world where young people's sexual and reproductive health and rights are promoted and protected, and let's do it now.